This is Helena at Large. I'm Helena Strauss, and today I'm giving you 10 tips for managing chemo-induced nausea and vomiting. As usual, these are my views as a myeloma patient. They are not substitutes for professional medical advice. Always seek the counsel of a qualified healthcare provider regarding your condition. The very first thing to know is that nausea and vomiting occurs when a place in our brains named the vomiting center is triggered. You might not have even known you had a vomiting center, but it has no doubt been working your whole life. The vomiting center works closely with the chemoreceptor trigger zone, also known as the CTZ, inside your medulla oblongata. When the CTZ picks up the presence of certain chemicals, it sends an alert to the vomiting center to mobilize its troops. You know what happens then. So, even though your cancer treatment may have disrupted the cells lining your digestive tract through radiation or chemotherapy, the key to controlling nausea and vomiting is keeping the CTZ from picking up signals and sending out an alert to the vomiting center in your brain. One way to keep the CTZ calm is with anti-nausea medications like ondansetron and others that lower substances which interact with the CTZ. Another way is by use of medications like Ativan and prochlorperazine, commonly associated with mood or psychological conditions, which lower the dopamine levels that excite the CTZ. Personally, I found anti-nausea meds helped me stop vomiting, but I was left with no appetite and lost a bit of weight. Medical marijuana fixed that for me, and I'll discuss my experiences with marijuana in another video. In any case, in addition to taking anti-nausea medications, there are many things with which you can experiment to keep your CTZ calm and your nausea at bay. Number 1, eat multiple small meals during the day instead of 2 or 3 larger meals. Number 2, avoid meals that are spicy or greasy, fried or fatty. Fatty foods in particular take longer to digest. Bland is often better. Number 3, sometimes just having a cold meal can help. Number 4, supplementing with smoothies and high-protein shakes works. Number 5, tart foods may be useful to you if food is tasting different to you. Number 6, hydration is important on so many fronts, so stay hydrated as well as you can, and if you have diarrhea too, hydration is especially important. Number 7, clear sodas without caffeine like lemon, lime-flavored sodas or ginger ale are sometimes soothing. They tend to soothe better, though, if you open them in advance and let them become flat first. And number 8, ginger root. Ginger root has a history of stopping nausea. There are chews, teas, and capsules. But ginger is an herb, so always run it by your doctor before adding it to your medications. Number 9, aromatherapy. Aromatherapy has the potential to confuse the CTZ and thereby help decrease nausea. More clinical research is needed, and I'm including links to the latest studies. But there is no indication that aromatherapy is harmful, so feel easy giving an inhaler a try. Personally, I found peppermint, but also mandarin orange and lavender helpful for nausea. And finally, number 10, acupressure. In traditional Chinese medicine, there are 2 high-potency points you can use to help reduce nausea. They are called pericardium 6 and stomach 36. P6 is found on the inside and in the middle of your wrist, 3 finger widths below the base of your palm. Stomach 36 is found on the outside of your shin below your knee. If you put your thumb behind your knee from the inside and wrap your fingers around the front, the point will be where the end of your middle finger lands. You can massage these points for a while, provided you have no cuts or sores, or what I prefer to do is get some paper bandage tape and a bag of dry beans. I preferred black-eyed peas for their size, and tape a bean over the points for half an hour or so. Having to manage nausea for weeks or months is one of the things that tests our endurance as cancer patients. And it's surely annoying when we've had to put so many things we find pleasurable on hold to also have the pleasure of food disrupted. When you have trouble managing, don't hesitate to ask your doctors or nurses for help. A change or an addition of a medication can help a great deal, and there are other tips that they may be able to offer. And lastly, if you want to impress your nurses when you are nauseous, ask for an emesis bag. May I have an emesis bag?
Emesis? Where'd you learn that word? I am so impressed.
Infusion centers and hospitals have emesis bags on hand. They're leak-proof and disposable. I grabbed a couple extra early on, and during treatment kept one in my car and one in my purse, just for security. The great thing was, like everything else in life, nausea wasn't permanent. Now I leave them at home. I'm Helena Strauss.